Good morning. We're going to discuss this morning Unit 3, and it's over Chapter 7 and Chapter 7 and Chapter 14. So Chapter 7 is the integumentary system and body temperature. The integumentary system is a complex organ that performs many different functions. So you will need to know the different functions that it performs. It's a mechanical barrier. It keeps harmful substances out of the body and helps retain water in our body and electrolytes. The acid pH of our skin surface serves as a protective chemical barrier. The skin also protects the internal structures and organs from injuries and microorganisms. It participates in the immune response against invading microbes, performs an excretory function, acts as a gland by synthesizing vitamin D, performs a sensory role by housing the sensory receptors for touch, pressure, pain, temperature, and it plays an important role in body temperature. The skin is called the integument or cutaneous membrane and is considered an organ. It is the largest organ in the body. There are two distinct layers, the outer layer or surface called the epidermis and the inner layer called the dermis. The study of skin and skin disorders is referred to as dermatology. The epidermis can be divided into 5 layers. 2 of the layers are the deeper stratum and the germinativium, and then the more superficial stratum corneum, and the stratum germinativium lies on top of the dermis and thus has access to a rich supply of blood. As the skin cells move away from the dermis, they die. That's why we slough off our skin cells. They undergo a process called keratinization, whereby a tough protein, keratin, and you've all heard of keratin, is deposited within the cell. The keratin hardens and flattens the cells as they move toward the surface of the skin. The keratin is what makes our skin water resistant. The skin reflects disease processes in the body. Many clinical disorders present initially with skin rashes. So a lot of times we'll find out, let's say for measles, for an example, the first sign that we see of the measles is a skin rash. The rash offers clues to the underlying problems. Drug reactions are often revealed by skin changes. Example, a person allergic to sulfa can develop a generalized rash that can progress to a lethal syndrome called Stevens-Johnson syndrome. And you may or may not see Stevens-Johnson syndrome in your early nursing career, but you may, and that's a person who's allergic to sulfa. And thus, it's another reason for nurses to make sure they pay very, very close attention to drug allergies. The skin also responds to chronic irritation and to stress levels. The dermis lies on the subcutaneous layer. This layer is not considered part of the skin. It lies under the skin and is therefore called the subcutaneous layer or the hypodermis. And you will learn how to give injections in the subcutaneous. This tissue performs 2 main roles. It helps insulate the body from extreme temperature changes in the external environment, and it anchors the skin to the underlying structures. Now we're going to talk a little bit about skin color. Deep within the epidermal layer of the skin are cells called melanocytes. Melanocytes secrete a skin darkening pigment called melanin. The melanin stains the surrounding cells, causing them to darken. The more melanin secreted, the darker the skin color. If the melanocytes completely fail to secrete melanin, the skin is white, and that is what we call albinism. Keratin gives the skin a yellow hint. Thus, when people eat a lot of carrots, their skin gets sometimes even orange colored. Poorly oxygenated blood causes the skin to look blue. This condition is called cyanosis. And as you take care of patients, you will always check for cyanosis, especially around the mouth and in their nail beds. And if you see that they're cyanotic, then there's a problem with oxygenation. A black and blue area on the skin is called ecchymosis, and you will have to chart if your patient has any ecchymotic areas. Bilirubin is a pigment in which a person with liver disease is unable to excrete. This pigment is instead deposited in the skin, causing it to turn yellow, a condition known as jaundice, and you will see that in the sclera of their eye and even actually on their skin. But you will, when you assess your patient, you will always assess the sclera of their eyes to see if there's any jaundice. You can read about the hair and information regarding hair in figure 7.2 of this chapter. Remember, attached to the hair follicle is a group of smooth muscle cells called the erector pili. Contraction of these muscles causes the hair to stand on end. And there's a graph there in the textbook showing a kitty cat with her hair standing up, and that's the erector pili muscle cells. Alopecia is the loss of hair, and you need to study all the terms regarding hair that are in this text. Nails are thin plates of stratified squamous epithelial cells that contain a very hard form of keratin. The nails are found on the distal, remember that term, end of the fingers and toes and protect these structures. You will see patients who have clubbing. This is caused by a chronic lung or heart disease. It indicates that the fingertips have received an insufficient supply of oxygenated blood over a period of time. The fingertips enlarge and the nails become thick, hard, shiny, and curved on the free end. So when you assess your patient, you will look at their nail, and if you see that it's curved, then that's what is, and you can't miss it if they have it. It's very noticeable, and so that's called clubbing, when their nails start curving on the end. When we talk about glands, there are two major exocrine glands are associated with the skin: the sebaceous glands and the sweat glands. We all know about sebaceous glands and that they cause blackheads and problems with our skin. The sweat glands, or sudoriferous glands, are located in the dermis. As the name implies, these glands secrete sweat. The sweat is secreted into a duct that opens into the skin as a pore. There are two types of sweat glands: the apocrine, usually associated with hair follicles and are found in axillary and genital areas, and they're responsible for body odor. The second type is the eccrine glands. They are located throughout the body. They play an important role in body temperature regulation. Modified sweat glands include the mammary glands and the cerumeous glands found in the canal of the ear that excrete earwax. Temperature regulation. Normal body temperature is regulated by several mechanisms. The thermostat of the body is located in the part of the brain called the hypothalamus. So that is what regulates our body temperature. And so if people have a brain injury, then oftentimes you will see their body temperature go very, very high. When temperature increases, our body produces sweat. As the sweat evaporates from the surface of the body, heat is lost. Newborns, the neonate cannot shiver. Shivering produces heat. The neonate has only a thin layer of subcutaneous fat, and fat prevents heat loss. The neonate has a large surface area that increases heat loss, and that's why babies and adults are oftentimes in the fetal position, because that conserves heat. The neonate produces heat by a process called non-shivering thermogenesis. Brown fat generates more heat than the metabolism of ordinary adipose tissue. So it's important to remember that a neonate does not shiver, and you have to really protect them against loss of Some terms, pyrexia, you will hear that throughout your nursing career. That means fever. Hyperthermia is elevated temperature. Hypothermia is a low body temperature. You will definitely hear that as you take care of your patients. So moving on to the endocrine system. The endocrine system is composed of endocrine glands that are widely distributed throughout the body. Endocrine glands secrete the chemical substance called hormones. Endocrine glands are ductless glands. That is, they secrete hormones directly into the blood and not into ducts. You need to remember that. Example, the pancreas secretes the hormone insulin into the blood, which then delivers the insulin to cells throughout the body. There's a figure in chapter 14.1 which shows the major endocrine glands of the body. The pituitary gland is considered the master gland. Hormones bind to receptor sites of the cells of their target tissue. Each hormone binds to a specific target organ. So each hormone has a specific organ in which it knows to go to. The two types of receptors are those located on the outer surface of the cell membrane, or membrane receptors, and those located within the cell are intracellular receptors. The hormone and its receptor can be compared to a lock and key mechanism. But there's a very good explanation of that in this chapter. A part of the hormone, which is the key, fits into the receptor, which is the lock or the target organ. And very interesting how these hormones know exactly which organ to go to. There are feedback loops. Normal endocrine function depends on the normal plasma level of hormones. Life-threatening complications develop when the glands hypersecrete or hyposecrete hormones. Glands know that they have secreted enough through a negative feedback control loop. An example, ACTH, secreted by the anterior pituitary gland, stimulates its target organ, which is the adrenal cortex, to secrete cortisol. As blood levels of cortisol increase, the cortisol in the blood chemically tells the anterior pituitary gland to slow further secretion of ACTH. So it's a feedback loop. And when the body knows it has enough cortisol, it tells the gland to quit secreting the ACTH. There is a hormone called oxytocin, and many of you probably have heard of oxytocin, that is released during early labor. When the uterus stretches, it causes nerve impulses to travel from the cervix to the brain, which in turn causes the secretion of the hormone oxytocin. The oxytocin is carried by the blood to the uterus, where it stimulates the continual contractions of the uterus, helping to deliver the baby. So remember, the endocrine system is composed of endocrine glands, widely distributed throughout the body, and these glands secrete hormones. Hormones are classified as either protein or steroids that exert widespread metabolic effects throughout the body and affect every organ system. Hormones stimulate target tissues by binding to cell receptors. The receptors are located either on the cell membrane or within the wall. 3 control mechanisms regulate the secretion of hormones: the negative and positive feedback loops that we talked about, biorhythms, and CNS activity. The pituitary gland is a very important gland in the body. It is called the master gland. It is attached to the undersurface of the hypothalamus. The pituitary gland has 2 main parts, the anterior pituitary and the posterior pituitary. It secretes hormones. Please look at figure 14.4a in your textbook, and it shows the major hormones and their target glands. An example is the pituitary secretes TSH, or what we call thyroid stimulating hormone, and it secretes that for the thyroid. you will see the physician ordering a TSH level. This is to check the function of the thyroid gland. It secretes ADH for kidney water reabsorption, antidiuretic hormone. We've spoken earlier about oxytocin for uterine contraction and milk letdown for the baby, and etc. So review all of these hormones. The text describes hormones of the anterior and posterior, so be sure and study all of these. Table 14.1 describes various hormones and their functions. An example, thyroid hormones T3 and T4. You will learn about more throughout your studies. They control metabolic rate. Thus, patients low on these hormones often take a supplement for thyroid. Calcitonin regulates calcium and phosphate levels. These are all in your textbook. The adrenal gland secretes epinephrine and norepinephrine, and we've discussed this previously, and we'll discuss it again about fight or flight syndrome. It also secretes steroids, cortisol, aldosterone, and sex hormones. Hormones of the pancreas, insulin is secreted by the beta cells of the islets of Langerhans, and you'll hear the islets of Langerhans throughout your nursing career. It helps lower blood glucose levels. Glucagon increases blood glucose levels. You have a homework assignment on this unit about Graves' disease. This disease is a hyperthyroid state characterized by bulging eyes, a condition called exophthalmia. And I had a friend that had a problem with this. The eyes bulge forward because the fat pads behind the eyeball enlarge and push the eyeballs forward in the eye socket. This is caused by an excess of thyroid hormones. So that's called Graves' disease, and you probably will see that. The hormone iodine, the synthesis of T3 and T4 thyroid hormones requires iodine salts called iodides. If there is an iodine deficiency, the thyroid gland enlarges and causes a goiter here in the thyroid. Parathyroid glands lie along the posterior surface of the thyroid gland. So behind the thyroid gland are the parathyroids. The parathyroid glands secrete parathyroid hormone. The stimulus for the release of parathyroid hormone, or PTH, is a low blood level of calcium. So you need to read about the overall effect of PTH and how it increases blood calcium levels, but it does that through that loop we've talked about. And you may hear the term tetany. Tetany is a term where the muscles remain contracted due to low calcium. So if someone's calcium gets too low, they can have contraction of their muscles. And this is called hypocalcemia, and it can be life-threatening. The adrenal glands are located above the kidneys. The AD in adrenal means near, and renal means kidney, so near the kidneys, above the kidneys. The adrenal medulla is the inner region of the adrenal gland and is considered an extension of the sympathetic nervous system. It is responsible, as I said, for fight or flight. Epinephrine, or adrenaline, and norepinephrine, which are classified as catecholamines, are secreted in emergency or stress situations. Catecholamines, causing the body to elevate its blood pressure, increase its heart rate, increase its glucose availability, increase its metabolic rate, and causes bronchodilation. So when those hormones are secreted, everything speeds up. Fight or flight. We spoke earlier about the pancreas. The pancreas secretes 5 hormones. We are concerned primarily with insulin and glucagon. As I told you before, the islets of Langerhans are the hormone secreting cells from the pancreas. insulin is released in response to increased blood levels of glucose, for example, after a meal. The secretion of insulin decreases as blood levels of glucose decreases. So after you eat, you've eaten a lot of carbs, then insulin is released from your pancreas, from the islets of Langerhans, and that then decreases your blood glucose levels. And it's again on that loop. So the body knows when it needs to secrete more insulin. It is released in response to increased blood levels, as I said. And the textbook refers to the word pig, P-I-G, meaning to think of the pancreas, P, insulin, I-G, glucagon. Diabetes mellitus is a serious life-threatening disease. A deficiency of insulin can cause severe metabolic disturbances, and you have an assignment also on diabetes. Hyperglycemia is an excess of glucose in the blood. It can be from the inability of glucose to enter the cells where it can be burned for energy, or it can be from the body making additional glucose. In the absence of insulin, the body makes glucose from protein. And as you know, and we'll learn more, diabetes is a severe, debilitating disease that causes many breakdowns of organs, systems in the body. Some terms: glycosuria means glucose in the urine. Polyuria means excretion of a large volume of urine. And usually if a patient is diabetic and they don't know they are, they will be excreting a large amount of urine, and they will have polydipsia, which means excessive thirst. They'll be drinking a lot of water and going to the bathroom a lot, and sometimes they don't. That's how they figure out that they have diabetes. Polyphagia is excessive eating, and many diabetics have polyphagia and cannot control their eating. Acidosis, as you learned before, is an excess of the hydrogen ion in the blood causing acidosis. Because the cells cannot burn glucose as fuel, they burn fatty acids instead. The rapid incomplete breakdown of fatty acids produces strong acids, or hydrogen, called ketoacids. This process causes a condition called diabetic ketoacidosis. And I just had a friend who went into diabetic ketoacidosis and was her blood sugars were over 600, and she was in ICU for a long period of time. It is a very, very serious condition. It is life-threatening. When you have a patient in diabetic ketoacidosis, what you will notice is a fruity odor to their breath, and it's very distinct. When you know they're in ketoacidosis, you pay attention to that and you will notice it. That is called from the rapid incomplete breakdown of fatty acids causing the formation of acetones, which is a ketone body. Acetone smells fruity and makes the patient's breath smell like rotten apples. A fruity odor is a sign of ketoacidosis. The treatment of diabetic ketoacidosis requires prompt administration of insulin, more than likely IV administration of insulin, and a correction of the fluid and electrolyte imbalances. And this is life-threatening. And that's what happened to my friend. She had a virus and was home alone and passed out, and all of this built up in her system, and her blood sugar just continued to rise. Her fluid and electrolytes were all out of balance, and so she required days of IV insulin and care. You can read about the Somogyi effect. It's a rebound phenomenon in which hypoglycemia is followed by hyperglycemia as a result of a hormonal overreaction to a low blood sugar. So what we're hearing here is the severity of diabetes and what all it can cause. Another term we hear is diabetes insipidus, and this condition is caused by a lack of ADH secretion, antidiuretic secretion. So antidiuretic is low and causes diabetes insipidus. It is important as nurses for you to understand insulin and its effects on the body, as well as glucagon, cortisol, growth hormone, epinephrine. You will be responsible for patients who may be brittle diabetics and therefore must be regulated very carefully so that they have the right amount of glucose in their body. Make sure you know and understand the medical terms at the end of the chapter and the disorders that occur. And that's the end of Unit 3. Thank you.